Hi, good morning, friends. I'm Dr. Sukhbir Singh, plastic cosmetic surgeon based in Delhi. So, today we'll talk about hair transplant and why hair treatment is very important. Hair loss is a very common problem, and especially in the COVID scenario, we are seeing a lot of hair loss problems. Nowadays, hair loss is very common in younger individuals, like in the age group of 20 to 25, and people come with very severe grades of baldness. So baldness can occur due to either genetic reasons or environmental causes or other associated reasons like patient is a chronic smoker or they have got some comorbidities like diabetes or which is quite treatable. So why does how does hair transplant help us? Let's understand that. So hair transplant is like a facial transforming surgery. Understand that a person without hair, a 24-25-year-old young guy who's without his hair, the front part and the middle part is not there. So typically he look like what? He look like a 35 or 40-year-old guy. He'll not have self-confidence, and people actually come to us because there's a lack of self-confidence. They are not happy. They don't like to see themselves in the mirror. They can't face the public. Sometimes they cover their scalp with the hat or something. They don't want to remove the hat. And like these, there are numerous problems which are associated with hair loss. So hair transplant is like a transforming surgery because first of all, it's a daycare procedure. That means you get it done. It'll take a couple of hours, depending obviously on the number of grafts required. The typical number of grafts in the initial stages ranges from 2,500 to 3,000 grafts, which is equal to about 6,000 follicles. Now, let me explain you very briefly what is the difference between a graft and a follicle because that's one of the most confusing term. Because if you go to a clinic, some people will talk in terms of follicles, some people will talk in terms of hair, some people will talk in terms of grafts. So, what is the standard and how do you really understand that? So, one graft basically means a hair with a root, okay? So each graft can have one or two follicles or maybe more. That means if I talk about one graft, so if I pull out a graft, so it can have one follicle, two follicle, three follicle, four. Up to four follicles is very visible. But in Asian population, we have seen usually one or two follicles is the most common, and up to three we have seen in couple of cases. Four or more is quite rare. So even if a patient has got one or two or up to three follicles in one graft, we are more than happy because we can give a quite a decent and good result. So whenever we talk about evaluation of a patient, sorry, we talk about graft because graft is a universal term. Now follicles can range differently in different population. If we go to the side, the Saudi side and all, the Arabic world and all, the number of follicles are much more. That they can have three or four follicles very commonly. So how do we evaluate a patient? So whenever patient comes to us, we see what is the balding area, and we tell the patient in terms of grafts because that's a much more uh, way of explaining the patient, which is a universal way of acceptance of that. So we talk about follicles. It is a varied term because a patient can have, as I said, two or three follicles per graft. Sorry. So if I say that a person requires about 3,000 grafts, that means about 600 follicles will be required for the patient. So we do not only limited session, but we do mega session, giga session. Sorry. So depending on the requirement, we can do the transplants on day one, or maybe divide into two different days. Sorry. So whenever the patient comes to us, we have to evaluate not only the requirement of the grafts, but also the recipient and the donor ratio. That means from where we are going to take out the hairs is called a donor area, and the recipient area is the one where we're going to transplant the hairs. So a donor to recipient ratio has to be conserved in such a way that we do not deteriorate the donor side. That means we do not finish the donor side, because understand, hair loss is a continuous problem. That means even after hair transplant, your original hair which are already present, they can undergo a loss sometime later in life. So obviously you have to have some grafts which are preserved for later use. So if we finish everything on day one, we will not have anything which is left for the later use. That's why the role of body hair comes into picture. That means after we take out the follicles or the grafts from the scalp, we have areas like the beard area, which is the next most common area after scalp, which we can actually easily use for increasing the density or filling the recipient area if the number of graft requirement is much more. Why beard area? Because beard area, the texture of beard hair is about 90% equal to the scalp hair, firstly. Secondly, the longevity of beard hair is almost permanent. Thirdly, you have to understand that the beard hair is easily accessible, and we usually take out the hair follicles or the grafts from the hidden area. That means the low chin area where it is not visible. So it can be easily deceived. That means it is usually a hidden area. So it is very safe to take from that area, and there is no morbidity after that. That means patient can continue his work without any morbidity if we use the beard area, and it is much less painful as compared to the other body areas. So after scalp, the number one area which we use for transplant nowadays is the beard area. So as I told you that whenever anybody talks to you in terms of the graft or follicle or hair, be very sure that they are talking in grafts or follicles or hair, because they might say you, oh, you require 10,000 hairs. That doesn't make sense at all. So either it should be a graft or exact number of follicles which we can tell you. Okay. So universal language is graft, so very acceptable. Now there are two ways to do a hair transplant. One is a FUE method. Excuse me. So one is the FUE method, in which there is no cut, no stitch involved. That means we, with a motorized machine and a punch, we punch each hair and take out each graft. Okay, so that each graft can contain multiple follicle hair or the single follicle hair. Okay, so the single follicle we usually use for the hairline. That means the first line, and after that we can use multiple follicle to give a very natural hairline and natural density. In FUT, we have to take out a strip, which is again subdivided into multiple parts, and from there each graft is taken out. Now, understand, each surgeon is trained to use either FUE, FUT. Like, I'm a plastic surgeon, so I can do both FUT and FUE. But understand, both the techniques in good hands give equal results. Patient will tell you, people will tell you, that, or some doctor will say only FUT is very good or only FUE is very good. That means that particular surgeon, in his hands, FUT is the best, or FUE is the best in a particular surgeon's hand. And sometimes you have to combine. That means FUT is combined with FUE. Why? We combine to give the extra density or the more harvesting of graft. And especially with the usage of body hair, the technique is so improvised that actually we can, in single session, take out FUE from the scalp, do FUE from the beard or any other body area, and we can easily cover the area. That means without taking out a strip, without putting stitches, without giving you neck spasm, we can easily take out the number of grafts which are required, and we can easily transplant it. Obviously, the transplant session can be split into day one, day two, or maybe, 1 week later, or whenever the patient and the surgeon are comfortable. If you have a very well organized team, like we have a very good team, and we can easily do up to 5 to 6,000 grafts in maybe a day if the patient is willing, or we divide into 2 different days. That means first day we do about 3,000 grafts, and second day again we do 3,000 grafts, so we can cover that area. So depending upon the patient's comfort, either we can do in day one or maybe divide into 2 days. Okay. Now the team should be very well trained for that. That means you should be ready to take out, not only do the harvesting but also do the implantation. Okay. So quicker the implantation process, the survival chances are very very high. So this is all decided, pre-decided with the patient during the consultation process, what the patient is comfortable. What we also do during the transplantation process is the combination of PRP. PRP is nothing but with the platelet-rich plasma treatment, which we combine along with the transplant process. So why do we add PRP to our transplant process? Understand that because PRP contains a lot of growth factors. It is rich in growth factors. So when we combine PRP along with the hair transplant, that means we are immediately giving a source of growth factors to the not only the new hairs which we are going to transplant, we are going to dip and use PRP for that, but also the existing hairs, we have to replenish them with growth factors. Understand that hair transplant is only one portion of a hair restoration process. So hair restoration process not only involves hair transplant, but also taking care of the original hairs. That means we need to preserve them, firstly. Secondly, how to increase the longevity of those hairs and prevent them from falling as much as possible. Obviously, nobody can prevent the complete fall of hair. That means nobody can guarantee you that, oh, my medication or serum will 100% control the hair fall and you will never go bald. There's nothing like that. Eventually, you may or may not go bald, but the serums, PRP, and certain medications which are very unique, they help us to delay the progression of hair loss. That means we can avoid. That means the transplant process. That means we can just transplant the front part. For the middle and the crown area, we can use the serums and the other treatment so that we can delay the process. As I told you that it's very important that the donor recipient ratio has to have a match. It is never a match, but we try to conserve the donor in such a way that we can use it for a later use. If we use everything today, for tomorrow we don't have anything left out. Okay, so it's very very important that you consult your doctor, make a plan with him, and understand, check his credentials is very important. Okay, check that you're being operated by a surgeon, or you just don't walk into a clinic where there are no doctors only available. So be very aware where you are going. Check the credentials of your doctor, check the credentials of the clinic, and then only step in for a process. Because understand, hair transplant is transformation surgery. It's not only a transplant that you're just walking in and doing a transplant. Basically, you are doing a facial transformation of yourself. Once you have a hair, actually your face gets transformed. Believe it. It's surgery. Obviously, it can be repeated. You can increase the density overall, but you should always go to a trained specialist. It's very very important. I hope this small video will help you to understand the hair transplantation process. Rest any other doubts, I am more than happy to answer you. You can always post in your chat box and we'll be answering your questions. You can ask them now or later whenever you post a question, we'll be more than happy to answer you. Any other thing, we are available for you. Thank you so much for watching.